There are many debates that go viral on the internet on a variety of topics that we hear about time and time again. In most cases, it could be as simple as a difference of opinion and preference about which actors would work better in a particular film, or as intense as a passionate disagreement over one of, if not the most, controversial topic shrouded in myths and misinformation that has been around for ages: vaccinations and their impact on our children. Today we'll talk about: do vaccines cause autism? Welcome to Autism Answers. We talk about autism with the goal of sharing knowledge and bringing awareness to light. Our goal is to make videos that are easy to understand so many will be able to understand and develop a deeper awareness of autism. With that said, we'll get into it. But first, let us have a brief overview of what autism is. As we previously discussed, autism can be characterized by a wide range of behaviors, but it is mostly characterized by an inability to communicate, linguistic deficits, a lack of sustained attention, a low level of activity, temper tantrums, sleep disturbances, aggression, inadequate motor control, and other non-compliant behavior. This sort of behavior greatly hampers the social and educational achievements of those involved and is detrimental to their efforts. Childhood autism affects millions of children worldwide. As a result, its manifestations have long been stigmatized as mental retardation, schizophrenia, or at the very least as bizarre behaviors. A developmental psychiatric neurological disorder has only become formally recognized in the early 1980s as infantile autism since the third edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-3, was published. The focus has now been on basic research as well as clinical, educational, and social care for infantile autism. The condition of autism is characterized by an abnormality of the brain that makes it difficult for a person to communicate and interact with other people. It is not known what causes autism, if any, or what causes it to develop. However, there are several factors that may contribute to the development of this illness in children, including genetics, differences in brain anatomy, and exposure to toxic substances in the environment. Now, vaccines have been the subject of a great deal of discussion and controversy in the last few decades due to a potential link between vaccines and autism. There has been an increase in concern about this due to the fact that children are developing autism after 18 months of development. A surprising finding is that autism can develop after a child has been vaccinated during the first 18 months of life. Researchers from the Food and Drug Administration admitted in the late 1990s that children under 18 months were susceptible to ethyl mercury found in immunizations. Consequently, methyl mercury, an organic mercury of renowned quality, may have been ingested by children. As a drug, methyl mercury must be administered in large doses beyond the recommended levels in order for it to cause autism. Furthermore, the National Autism Association has expressed concerns about the use of thimerosal as a preservative within vaccines. There is evidence that thimerosal increases the amount of mercury in vaccines by a significant amount, according to a significant number of research studies. However, thimerosal does not contribute to autism. It is untrue to suggest that the prevalence of autism increases with the number of vaccinated children. The vaccine does not cause autism, regardless of the unfounded claims regarding the disorder. An article in 1997 paper published by Andrew Wakefield, a British surgeon, was the source of the widespread fear that vaccinations increase the risk of autism. There was an article published by The Lancet, a prestigious medical journal, suggesting that the measles, mumps, rubella, MMR vaccination increased autism in British children. Due to serious procedural errors, undeclared financial conflicts of interest, and ethical violations, the paper has been irreparably discredited. The Lancet retracted Wakefield's paper as a result of his loss of medical license. Nonetheless, the hypothesis was taken seriously, and several other major studies were conducted. Among those who examined the hypothesis, none of them discovered a link between vaccination and the likelihood of developing autism. In a statement released by the Center for Disease Control and Prevention, the CDC, and the Institute of Medicine, the IOM, both organizations warn against the association between vaccines and autism. These revelations are based on the amount of antigens a child receives from the first day of vaccination to the age of 2 years. As a result of the research, it has been determined that vaccines are not associated with autism spectrum disorder, ASD. A child with autism and one without exhibits the same amount of antigens regardless of the vaccines administered. Furthermore, increasing vaccine antigens does not result in the development of autism. Recent years have also seen a decrease in the amount of vaccine antigens administered to children. Throughout history, vaccines with low amounts of antigens have been developed. At least 6 antibodies are produced by cellular pertussis vaccines. An important point to keep in mind is that a child's immune system can respond to multiple sources of immunological stimulus. Therefore, a child is exposed to numerous antigens and pathogens that are not connected to vaccines. It should be noted that the claims that thimerosal causes autism are unfounded due to the fact that the substance cannot preserve vaccines these days. From a clinical perspective, autism is viewed as a disorder caused by brain damage. Accordingly, a child's brain will operate in an abnormal manner compared to that of a child of the same age and type. Considering a clinical point of view, it's important to remember that there is no single cause of this disorder. This is why biologists will assume that autism is a result of hereditary, genetics, and the environment as a result of hereditary, genetic, and environmental factors. Before we continue, we'd like to ask for a few moments of your time. If you want to support Autism Answers and its mission to spread awareness about autism, please leave a like and click on the subscribe button. This would help us to create more engaging content for you. Now, moving back to where we left off. There have been an extensive study conducted on families with autistic children that has revealed that there is a likelihood that the disorder may be inherited due to irregular genetic coding. As a consequence, if a child is born into a family that has a history of autism, this child may be at risk of developing autism. In the opinion of medical practitioners and pathologists, genetic vulnerability may be a factor in the development of autism. Consequently, this means that a child with tuberous sclerosis or congenital rubella syndrome, a medical condition which is associated with increased risk of autism, could acquire the condition as a result. The third and final contributing factor to autism in children could be environmental factors, such as exposure to mercury toxins. Nowadays, there are more mercury toxins on the market than in the past. Mercury toxins are more prevalent today than in the past. It's for this reason that low levels of mercury in vaccines may not be leading to autism in children at such a young age. The Center for Disease Control and Prevention, the CDC, released another study in 2013 to add to the amount of evidence that vaccines do not cause autism spectrum disorder, ASD. The study focused on how many antigens were given to newborns during the first 2 years of their lives. An antigen is a subunit of a vaccine that stimulates the immune system to produce antibodies to fight a disease after the ingestion of the vaccine. The results show that the total amount of antigens obtained from vaccines received by children with autism spectrum disorder and those that did not have autism spectrum disorders was the same. It is astounding that despite the overwhelming evidence that vaccines are safe and effective, some parents still decide not to have their children vaccinated or delay vaccinations for their children. Nevertheless, this is a very risky tactic, since vaccine-preventable diseases like measles are still prevalent today. It is highly possible that a child unvaccinated with one of these preventable diseases can get very ill, if not fatal, and that other people around the child could also get sick or even die as a result. Following the administration of a vaccine, some kids may experience a mild fever or rash as a result of the vaccine. Although it's clear that the MMR vaccine and other recommended vaccines are associated with some serious side effects, such side effects can be easily overlooked when compared to the health risks associated with the often serious diseases that these vaccines can prevent. But the risks are not as significant as those associated with the vaccines themselves. You should speak with your health care provider if you have any concerns about any vaccine that has been recommended for your child. Ensure you understand the benefits and risks of each vaccine and why they are so important to avoid illness and disease. And that's what we have for you today. What are your thoughts? Let us know in the comment section down below. If you want more content related to this topic, make sure to check out our channel. Take care, and we'll see you in the next video.